Today I'm going to discuss to you about the very important topic in cardiology is about the phases of cardiac muscle action potential. This topic is very important for understanding of cardiac cycle. So coming to the topic, the first phase is initial repolarization. What is it? Initial repolarization. So here you can see how does it occurs. This occurs due to fast sodium channels close. See, the sodium channels close, the cell begins to repolarize, and the potassium ions leave the cell through the potassium channels. So, for the initial repolarization to occur, the sodium ions should retain in the cell, and the potassium ions should leave the cell through the channels. Okay, so this part, this one in the graph is called initial repolarization. So, this initial repolarization is followed by a plateau. See, this one horizontal thing is called as a plateau. This is very important in the cardiac cycle. See how this plateau is formed. See, this is a very characteristic thing in the cardiac muscle. This plateau is not present or not does not occur in the skeletal muscle. This occurs only in the cardiac muscle. So, if we see here, calcium channels open and fast potassium channels close. Okay, so what happens in the initial repolarization, potassium ions are leaving the cell, but during plateau what will happen? Calcium channels will open and fast potassium channels will close. So there is no further leaving of potassium channels from the cell. A brief initial repolarization occurs and the action potential then plateaus as a result of increased calcium ion permeability and decreased potassium ion permeability. Okay, so how this plateau occurs is because of more amount of calcium starts entering into the cell and the potassium leaving to the cell will be stopped. Due to the entry of more amount of calcium into the cell, this plateau will occur. The voltage gated calcium ion channels open slowly during phases 1 and 0 and calcium enters the cell. Potassium channels then close and the combination of decreased potassium ion efflux and increased calcium ion influx causes the action potential to plateau. Okay, is it clear? So, increase in calcium ions into the cell, which is called efflux of calcium ions, and decrease in potassium ions to the outside of the cell will leads to the plateau of the cardiac cycle. Understand? See, the last point is that potassium channels then close and combination of decreased potassium ion efflux and decreased potassium ion efflux. So potassium ions going outside will be decreased and large amount of calcium influx will be increased. So that is called more amount of calcium entering into the cell and very less amount of potassium will be leaving the cell. So accumulation of finally calcium ions in the cell will leads to this plateau. This is called the second stage, phase 2. Then followed by phase 3, which is called rapid repolarization. What is it called? Rapid repolarization. Calcium channels close and slow potassium channels open. Here what happens again, calcium channels close and the slow potassium channels open. The closure of calcium ion channels and increased potassium ion permeability permitting potassium ions to exit the cell rapidly ends the plateau and retains the cell membrane potential to its resting. Okay, so here what happens again, rapid repolarization occurs. In rapid repolarization what happens, this calcium channels close and what happens, slowly potassium channels open. When the calcium ion channels are closed, there is no further entry of calcium, while the increased potassium ion permeability permitting potassium ions to exit the cell rapidly ends the plateau and retains the cell membrane potential to its resting. Okay, this is how happens initially in the initial repolarization. Also here also you see the potassium ions leave the cell through the potassium channels, then the repolarization occurs. So here also in phase 3 also the potassium channels will open and the potassium start to leave the cell and this leads to formation of rapid repolarization. Okay, Then the fourth phase is resting membrane potential. This average about 80 to 90 millivolts. This average is about 90 to 80 to 90 millivolts. So after resting, again the membrane should be depolarized. That is called phase 0. So how this depolarization occurs? Fast sodium ions open when the cardiac cell is stimulated and depolarizes. The membrane potential becomes more positive. Voltage gated sodium channels, fast sodium channels open and permit sodium to rapidly flow into the cell and depolarize it. The membrane potential reaches about 20 millivolts before the sodium channels close. So how does a depolarization occurs? Depolarization occurs by fast movement of sodium ions into the cell, okay, which is voltage gated sodium channels. Okay, fast sodium channels open and permit the sodium to rapidly flow into the cell, and it leads to depolarize it, and the depolarization potential reaches about plus 20 millivolts. Okay, this is called depolarization. Now how the depolarization occurs? Depolarization occurs by, see, in depolarization what we have seen, sodium channels permit the entry of sodium into the cell and it makes the potential to 20 millivolts. But in initial depolarization what will happen? This fast sodium channels close, the sodium channels close, the cell begins to depolarize and potassium ions leave the cell through the potassium ion channels. Okay, so whenever the sodium entry is stopped and whenever the potassium ions are leaving the cell through the potassium channels, then the initial depolarization occurs. This initial depolarization is followed by a plateau. This plateau is formed by the more influx of calcium into the cell and more efflux of potassium outside to the cell. Okay, the more influx of calcium through voltage gated calcium ion channels causes this plateau, and the moving of potassium channels from the cell into the extracellular space will contribute for the formation of this plateau. Then followed by rapid repolarization. This occurs by slow closing of closing of already open calcium channels and slow open of potassium channels, where these potassium channels will exit the cell rapidly and ends the plateau and returns the cell membrane to its resting. Okay, so these are the very important stages of cardiac muscle action potential. Okay, so this can be asked in any in a 4 marks or 8 marks question, and this can be asked in any bit also, like how many phases of cardiac action muscle action potential is there, and how does plateau occur by influx of which ion, either calcium, potassium or sodium, none of the above, which we have to answer. Influx of calcium ions and efflux of potassium ions will leads to formation of plateau of the cardiac muscle. Understand? Right. Thank you for listening.